Today is December 8th, 2011. The Institute of Medicine recommendation number 6 for the nursing professional, how to continue lifelong nursing education. Prepared by Jesse Rogers, Stratford University, student of nursing. Author note, Dr. Pamela McCullough, CPNP, Department of Nursing. When people think of history of nursing education, many immediately think of Florence Nightingale. However, nursing goes back even farther than that. In fact, during the 18th century, a slave named James Durham was able to buy his own freedom from the money he earned as a nurse. Nobody knew back then that nursing education could be ever obtained in any other way than simply hands-on through an apprenticeship. But today, there are many ways to study and learn about more of nursing. Florence Nightingale was the first lady to the nursing environment. Florence was the daughter of a well-to-do family in England. They wanted her to become a socialite, to learn to give big parties and serve tea. Florence, however, had other plans. She told them she didn't want that kind of life. Her family became very angry and did not support her decision to become a nurse. At the age of 16, she was sure that God was calling her to serve others. She used every spare minute to learn from nursing books she had secretly obtained. She visited hospitals in London and the surrounding area. She decided to go to Kaiserwerth Hospital in Germany to study. She was an excellent student, and after graduation, she returned to London and got a job running a hospital and being a top nurse during the Crimean War in 1850. In 1954, she was asked by the British Secretary of War to become a nursing administrator to oversee the introduction of nurses to the military hospitals. As the past years, Florence was bedridden due to horrible illness, but this did not stop her dedication and drive to improve health standards, which include the publishing of 200 books, reports, and pamphlets. In 1860, she opened the Nightingale Training School for Nurses based at St. Thomas Hospital in London, where the first 10 nursing students were enrolled. At the age of 90, Miss Nightingale lost her battle with the illness, but yet her legacy, her accomplishments still live on in today's nursing fields and environment. Another important pioneer in nursing was James Durham. Born a slave in Philadelphia in 1757, his early masters taught him the fundamentals of reading and writing. Durham was owned by a number of doctors, ending up in New Orleans with a Scottish physician who hired him in 1783 to perform medical services. When he was just 21 years old, he bought his freedom and decided he could do more help and help more people being a physician. So he went to New Orleans and opened up his own medical practice. He was a popular and distinguished doctor, and being able to speak English, French, and Spanish stood him out from the other successful doctors. He was invited to Philadelphia in 1788 to meet Dr. Benjamin Rush, one of the signers of the Declaration of Independence. Rush was so impressed with Durham's success in treating diphtheria patients that he read Durham's paper on the subject before the College of Physicians of Philadelphia. In 1789, Durham returned to New Orleans, where he saved more yellow fever victims than any other physician in Philadelphia. During an epidemic that killed thousands, he only lost 11 of 64 patients. He moved back to New Orleans, but despite his skill, his ability to save so many lives, and his flourishing practice, his practice was restricted in 1801 by new city regulations because he did not have a formal medical degree. He disappeared after 1802. His whereabouts today are still unknown. Now, more than 80 years later, a nursing education is available at college campuses via online courses and even through nursing education programs. Men and women who want to become nurses or just keep up with all the modern technologies and changes can do so around their schedule and take advantage of all the study options for this amazing profession. There are many choices when it comes to online nursing education, as prospective nurses should really compare all of the programs to ensure they are studying from the best online university and they are learning as much as they can about nursing. Now, more than 80 years later, a nursing education is available at college campuses via online courses and even through nursing continuing education programs. Men and women who want to become nurses or keep up with all the modern technologies and changes can do so around their schedule and take advantage of all the study options for this amazing profession. There are many choices when it comes to online nursing education, and prospective nurses should really compare all of the programs to ensure they are studying from the best online university and that they are learning as much about nursing as possible. Over the past several years, policymakers, researchers, and practice leaders have identified that education does make a difference in how nurses practice and how that transpires to the best patient care possible. The BSN nursing program includes all of the content that the diploma and associate programs include, but it also provides students with a more in-depth study of the physical and social sciences, nursing research, nursing leadership and management, community and public health nursing, along with humanities. This broader and more in-depth education enhances the student's professional development and allows the BSN graduate to better understand the many cultural, social, economic, and political issues that impact patients and influence healthcare across the spectrum. Several studies have demonstrated an inverse relationship between the proportion of BSN nurses and the mortality of the hospitalized patient. In other words, they found that as a BSN degree registered nurse increased in hospitals, patient deaths decreased. This study demonstrates that lower levels of patient mortality are associated with nurses' education levels. It is in the best interest of all people involved for everyone to have the same type of higher education. Continuing education is one method for acquiring competency in informatics among nurses that is needed. However, little is known about nurses' participation in continuing education and the factors of characteristics that motivate them to pursue this type of education. A survey done in the year 2000, out of 25,000 nurses across the United States, only 21% reported continuing education or the means of doing so. But results do show an increase of probability with the use of internet access. But as the chart shows, the ongoing BSN nursing degree climbed steady to the great path since 2005. For the future of nursing, there are significant barriers that must be overcome from having a shortage of nurses. This will offset and provide more advanced and expanded nursing roles that will be filled. Having enough nurses with the right kind of skills and education will contribute to the overall safety and quality of a transformed healthcare system. One such barrier is high turnover rates. The costs associated with these turnover rates are significant, particularly in hospitals and nursing homes. The high rates among newly graduated nurses in particular highlight the need for a greater focus on managing the transition from school to practice. In the 21st century, healthcare has made many dramatic turns. 20th century nursing education is no longer adequate for nursing in the 21st century. But yet, as time moves forward, so many nursing professionals do not have a new onset skills and education levels, which is causing many problems. Patient needs, nursing, and patient environments in today's diseases and cancers have become so much more complex. It is the nurse's responsibility to deliver high-quality care, including leadership, management, policy reform, and teamwork to the front lines of the nursing profession, as well as continuing education to keep up with these ever-growing changes and needs. There are many questions on everyone's mind pertaining to pros and cons of continuing education. What will it take for the nurse that has been in the field for 10 to 20 plus years to get a newly transformed nursing education, as the new nursing students are learning this newfound education and will be applying these significant changes once out of school and in the field? Will hospitals, clinics, doctors' offices be able to make the nurse receive higher education on their own time and dime? Will there be any repercussions for not doing so? There are so many unanswered questions that pertain to the subject, but have researched this very important, interesting IOM recommendations that are definitely more pros than cons. What are your thoughts? The purpose of this paper is to show the need to increase the percentage of registered nurses with BSN degrees. The federal government recommends that 80% of nurses obtain their BSN degree by 2020. For there are many choices such as private and public schools and universities that are putting together bridge programs. This permits the hardworking nurse and specialty nurse with today's busy shift schedules, combined with family life, obtain the higher education needed in today's nursing force. With more than 3 million members, the nursing profession is the largest segment of the nation's healthcare workforce. Working on the front lines, nurses have a direct effect on patient care. Nurses must be prepared to meet diverse patients, function as leaders, and advance science that benefits patients and to deliver safe, quality, patient-centered care. It is in the best interest of all people involved for everyone to have the same type of high education. Continuing education is one method for acquiring competency in informatics among nurses that is needed. However, little is known about nurses' participation in continuing education and the factors or characteristics that motivate them to pursue this type of education. A survey done in the year 2000 out of 25,000 nurses across the United States, only 21% of continuing education or the means of doing so. But results do show an increase of probability with the use of internet access.